Just wanted to show you guys something that's really interesting, because if you are not using AI in your clinic at the moment, then you should be, and you should be understanding this technology, because it is going to absolutely change the space. So I wanted to show you just how I was using it today. So I wanted to look at, I've changed some of these bits of data to make sure that she can't be identified, but I wanted to see what ChatGPT came up with when I started doing some clinical reasoning. So I put in, I've got a 20-year-old runner experiencing proximal tibial pain. She's experienced sharp pain that shoots towards the knee after a period of increased running distance. What could be causing this? So it came through to look at the top differential diagnoses. Now, I'm not saying that this is going to be a replacement for physios yet. However, it could be a good tool if you've got a patient that you are unsure what's going on, to give you ideas about where you would explore next and what research you would explore next. So went through, so my initial suspicions was that this was a stress response, particularly because I'd actually seen on the ultrasound that there was a stress response. But I wanted to see, because she'd had an irritation, what would be the next sort of guidance that we could do. So you could look at this and then go into a particular area and look at sort of the differential diagnoses, running things to consider. So you could go back, especially with a junior, and say, they could look and say, were the shoes different? Was there an overload? So recommended steps. This is actually giving me a different answer to the one that it had before. What tests would rule out stress fracture? And then it was able to go through and look. So hop test, Fulcrum test, and then I had done the tuning fork one. So we looked at that. And then it started talking about imaging studies. When should I refer for MRI versus sit and wait NHS UK? Because of course this is looking, and remember that this is a little bit outdated because it's 4.0. Now I do pay for the £200 a month one, so I may have a little bit more features, but you can have a little look here. This could be used as a really interesting tool to help you. So something like REDS, this was something that I asked her about, whether there was any history of any eating disorder that might increase her risk of having a stress fracture. But I just wanted to share this, because as I was doing it, I was like, wow, this is really, really powerful to be able to see what AI is doing, what it is capable of. And so that, you're getting ahead of the game. So it says, would you like a quick referral letter template or decision tree for the NHS use? So I'm just going to say yes, just see what it puts back to me. Here's a referral letter. So for somebody like myself who really struggles to write down, the right template for something as straightforward as a letter, someone who might find it difficult to organise, you could put in your clinical notes and ask them to create a letter. Of course, you need to change it. This is a template, but it would perhaps improve the communication and make it really clear what you're requesting. So I'd be interested to know what you think about this particular template for a letter. Clinical summary, red flags, clinical concerns, request. Okay, I'm going to ask it, yes, I want a decision algorithm. Let's see what it says. It's interesting. Very, very interesting. Do you want this as a PDF handout or printable version from clinic use? So let me know your thoughts, comment below. I'd be really interested to see if you're using ChatGPT, and whether you agree with this, if you think it's absolute rubbish, or whether you think this can be a useful tool.